Welcome everyone. We'll get started based on the fact that we have probably some online participants that have logged in. So I'd like to thank everyone in attendance, those that are here today and those that are joining us online. Today's presentation will walk you through an introduction, a review of the rate setting process, including industry premium rates, how the rate model kind of works at a high level, the transition from what was the current model to this enhanced model, and then what the next steps are. I'd also like to take a minute, this opportunity to kind of set expectations regarding the information you're going to receive in today's presentation. We'll not be giving you your 2019 premium rate, but we will show you a comparison of your 2018 premium rate under the old model and under the enhanced model, and some information of what is driving those differences. This will give you an idea or a sense of what to expect for 2019 when the transition from the current model to the new model is removed. We're providing this information to give you the opportunity to plan and prepare for potential premium rate increases, or an increase. We've scheduled about an hour for the presentation, roughly an hour for questions after the presentation. For those attending online, you can submit your questions to askwcb@wcbsas.com. And we'd ask everyone maybe to hold their questions to the end. So make note of any questions that you have, and then we'll kind of ask them all at the end. And then there'll be microphones. So if you could use the microphone so that everybody, not only in the room but online, can hear the question that you're asking. So at a high level, what do your premiums cover? As employers, you fund the compensation system and are protected from being sued if there's a workplace injury. The premiums you pay ensure that your workers are protected if they're injured on the job. They'll receive wage loss benefits, medical benefits, rehabilitation benefits. So at a high level, employers are protected from lawsuit, and they're able to provide their workers with an insurance program that supports them if and when they're injured on the job. The main objectives of the rate setting process are to ensure that the overall premium requirements of the WCB for the upcoming year are met. Premiums should cover all current and future costs for claims from employers operating during that year, including workers' compensation, wage loss benefits, the vocational rehabilitation benefits, health care, survivor benefits, administration, and the funding of safety associations. The rate model also ensures that the distribution of these revenue requirements across all employers is equitable. While maintaining collective liability, it should promote accountability and fairness and recognize injury prevention and disability management practices. It's important to note that there are two key components or drivers into the calculation of your premium rates: claims costs and payroll. The costs associated with workplace injuries that have occurred in the past help us project what future claims costs will be. The second component, payroll, drives the premium rate. That drives the premium rate is the employer payroll. Payroll is collected for all workers in all industries subject to coverage under the Workers' Compensation Act. Premium rates are set based on the ratio of claims costs to payroll. WCB is funded by the premiums employers pay and the investment income earned from those premiums. Premiums that we collect in a year are intended to cover all costs of claims that happen in that year. So if someone is 15 years old and injured, severely injured, we'll collect enough money in 2018 to pay for the lifetime of costs for that claim. And some claims could go on for 50 years. An actuarial model is used to predict claims costs for the upcoming year. Actuarial models ensure financial stability and security of benefits for injured workers. Costs include an industry's their own claims costs, as well as a portion of shared costs, which, because it's an insurance program, there is collective liability. At some level, all employers will share in some of the costs associated with injuries. This slide outlines the events that have really gotten us to this point today. Back in 2015, the WCB conducted an asset liability study through an external consultant. It was through this study that there was a recommendation that the rate model should be reviewed. So in 2016, as a result of the recommendations in the asset liability study, a review of the rate model was completed by an external actuary. The report, we received their report in September of 2016. The external actuary was called Eckler. In November and December of 2016, we did province-wide education sessions to educate employers about the enhanced rate model. Then in early 2017, February and March, we had industry rate code employer sessions to educate them about the information and the potential impact of changes from the current system to the enhanced system. And we also consulted employers during those sessions about transitioning to this enhanced rate model. The model became effective in 2018. However, we did transition, as we'll learn through the presentation, we did transition the rate codes that were seeing potential increases. This week, we're hosting the education sessions again to reinforce for certain rate codes that they may see their premium rate increase under this enhanced model. And if I'm remembering correctly, I think there were about 14 rate codes out of 50 that would potentially see their premium rates increase in 2019. So the current rate model is based on some key principles, and some of those principles are competing principles. For example, collective liability and accountability. So under accountability, premiums paid by current employers should cover the costs of their injured workers during the premium period. This principle covers what we call intergenerational equity. Current employers should not be paying for the claims costs generated by past employers, nor should they be subsidizing the claims costs of future employers. It also covers something called intragenerational equity, meaning employers that incur costs should be responsible for the costs associated with those injuries. A fair rate making model encourages workplace safety and effective return to work policies by financially incentivizing employers' positive behaviors. Competing with that at times is the concept of collective liability. So while we want to hold industries and employers accountable for the injuries and claims costs that they're incurring, it's an insurance program. So employers as a group and those within the same industry are jointly responsible for all workers' compensation costs. Also, employers should not be excessively punished for unusually costly claims. Thus, portions of unusually high-cost claims should be shared by all employers. So these two principles compete as it relates to holding individual employers and rate codes accountable, but actually having an insurance program where there's collective liability. On the other side, there are the competing issues of rate stability and reactivity. Employers should rely on a level of predictability and stability in rates. Employers do not want their rates bouncing up and down excessively from year to year. It's hard to plan and manage. On the other side, industry should expect quicker recognition of successful prevention initiatives and claims management practices. It should also be quick to recognize industries with poor safety performance. At the end of the day, we want this model to be transparent and easy to understand. Employers should be able to understand the factors that went into setting their premiums, and the WCB should be able to clearly communicate this information to employers. And if we think about the insurance of our vehicles, so if the people that have similar vehicles as you start off by paying the same insurance premium for your vehicle. Depending on the number of claims or claims costs or high-risk behaviors you have, your premiums might go up. If you don't have any claims over time or you're not involved in high-risk activities, then your claims costs or your premium rates might go down. But if your vehicle, for any number of reasons, stolen and totaled or whatever the case may be, if it's totaled, you are not going to be responsible for replacing that vehicle, the costs of replacing that vehicle. The insurance program does. And it's because of collective liability, all employers paying into that insurance program, that they're able to pay for the replacement of that vehicle. It's the same concept with WCB. It's an insurance program where we're trying to hold individual organizations and rate codes accountable, but yet have that collective liability insurance, so if in the event of extremely bad situations, high cost claims, that you're not unfairly burdened. Because the difference sometimes between an injury where somebody gets up and walks away, or a situation where somebody gets up and walks away, and somebody who suffers multiple serious injuries, sometimes that can be a second, sometimes that can be an inch to the left, a couple centimeters to the right. The difference between a fatality and a near miss can be very minimal. So we're balancing these competing principles and trying to make a fair compensation system. So what are the components that go into this enhanced model? How is the rate-making model changing? At its highest level, the key drivers of premiums are still costs and payroll. The enhanced model changes the way we estimate these costs for the upcoming year. The following 6 components impact industry premium rates under the enhanced rate model. So this overview is going to provide kind of that high-level overview of the components. If you want more detailed information about the rate model, we do have information on the website, and I think we've got some videos on our YouTube channel. And at the end of the day, if you're going through that and you still have questions or you want to talk to us, you can just contact us and we'll try and arrange for a meeting to sit down with you or a group of employers in your industry and go through the model itself in more detail. So let's go through kind of a high-level overview of the 6 components. The first one is credibility of industries. Credibility is the extent to which you can use the past to predict future experience. Under the current classification structure, there are a number of smaller industry rate codes with lower credibility, making it more difficult to predict future claims experience. So the change we made here was for rate codes that are not fully credible, their experience should be complemented with a longer experience period. For example, using up to 10 years experience versus a 5-year window. We'd no longer supplement. So what we used to do is we'd supplement an industry's experience with the board level experience. Now we won't do that. What we'll do is we'll look at a longer window of your industry experience to figure out how to predict past costs to future costs. So what does this mean? This adjusts credibility to use more of an industry's their own experience, so you're more accountable for your experience. You achieve a reasonable balance between reflecting recent experience and reducing volatility for smaller rate codes. This also improves predictability. So for example, if 5-year cost history of a rate code was 80% credible, We use 80% of the 5-year experience and then 20% of the 10-year experience to get the rate code to 100% credible and use that experience to predict future costs. The second component is use of indicators to predict costs. Under the old model, we projected the number of time loss claims and the expected future costs associated with those claims. The concern with this method is that while the number of claims has been declining, there has not been a proportional decline in costs, particularly when we look at long-term claims costs. So the change we made there was where we will use something called the evolution of workforce, not the number of time loss claims, to determine future claims costs. The evolution of workforce considers the change in the number of workers in that rate year to estimate future costs. So if the number of workers are going up, we would expect costs to go up. If the number of workers are going down, we'd expect costs to go down. So what does this mean? It increases rate stability and increases the ease of understanding why we're expecting your costs to go up or down. The third component is costly claims pooling. Cost pooling is when costs are spread amongst a larger group of employers. For example, certain costs may be allocated at a rate code level or amongst all employers in the system. This increases collective liability so that a group of employers are not unfairly burdened. Under the old model, we only pooled pension costs above $90,000, and it was done at the class level. And then we redistributed that based on a fixed percentage of payroll. So it was very limited pooling other than the way we handled fatalities. The change that we were proposing, that we made, was we're applying pooling at 3 times the ultimate maximum wage, which is a better balance between an industry being held accountable for their own claims and collective liability for those rare, high-cost injuries. Costs in excess of 3 times the ultimate maximum wage rate are pooled now at the board level and allocated back to industries based on the industry's proportion of costs. And right now, I think the maximum is just over $252,000. So an employer in industry will be accountable for the first $252,000 of a claim. All costs after that will be pooled with all employers, and then those costs reallocated based on your proportion of costs in the system. So what does this mean? It's going to increase collective liability, it's going to improve our ability to predict future costs, and it's going to increase transparency in terms of where the costs are going and how they're allocated to your rate code. Fourth component is the allocation of fatality costs. Under the old model, the costs of fatalities were allocated equally to all industries based on a 10-year average. The change is that all costs arising from fatalities will be charged to your rate code in which they occur. And we're treating them like every other claim. So if a fatality-related costs hit $152,000, 3 times maximum, the industry is going to be accountable for that first portion. All other costs will then be pooled amongst all employers and then reallocated based on costs. What does this mean? It increases fairness. It's holding employers and industries more accountable for fatalities, because we've moved from 100% collective liability to having industries now responsible for fatalities. The fifth component is what we call long-term claims, how we handle long-term claims. So when we're projecting future costs, the old model considered costs paid during the past 5 years for claims that occurred in the past 50. So you may have had a claim within your industry 50 years ago, and if there were costs incurred in 2017 or 2016, we would pick those costs up and include it into how we were projecting costs going forward. The change is it applies all costs for the first 7 years of a claim to the industry experience. Remaining costs are pooled at the board level and allocated back to industries based on the industry's proportion of costs. What this means is it's increased reactivity by putting emphasis on a rate code's most recent experience, and it increases accountability to industries because for the most part you are being accountable for your most recent experience, your most recent 7 years experience, and it increases collective liability for old claims costs. So those claims, any costs over the 7 years. The first 7 years. And the sixth and final component of the model is the allocation of administration costs. The change here is we increase the fixed component of administration costs from 10% to 30% to better align with the allocation of fixed and variable costs to reflect the actual WCB admin structure. So the way we look at it is fixed is related to all the costs that we would have for human resources, IT, setting up employers in the system, charging them their premium rates, payroll, assessing their payroll. So all those things that we do for all employers pretty much every year. On the flip side, the variable costs are those costs associated with administering claims. So both the fixed costs and variable costs are our whole administration. But the variable costs are specific to the people who manage the claims. And those industries that are utilizing those resources more will pay more. So what this does is better reflects how our administration costs are actually allocated. About 30% of our administration costs are fixed costs. About 70% are related to managing claims. So this increases fairness. It's holding everyone accountable for their fair share of the fixed costs, and then holding those accountable who are having more claims and utilizing those resources more accountable for the variable costs. So in general, this move will see typically industries with lower premium rates paying more as it relates to fixed costs. Because in the past, we had only identified our fixed costs as 10%, but in reality, it was closer to 30% of our total admin costs. So that's a high-level overview of the changes in the model. This slide reinforces that 2018 is a transition year for some rate codes. The enhanced model was implemented for 2018 after customer consultation, and the board decided to transition the impacts of those whose premium rates would increase under the enhanced model for 2018 only. The move to the enhanced model means that 14 rate codes would see increases as a result. To mitigate the impact of those increases, WCB drew from the injury fund to cover the costs associated with the transition. This is being done for 2018 only. The board's funding from the injury fund will cover the difference, or did cover the difference, between what an employer would have paid in 2018 and ultimately what you will pay in 2018. Those industries whose premium rate decreased under the enhanced model had their premium rates actually calculated under the enhanced model. Starting in 2019, all industry premium rates will be determined under the enhanced model with no further transition being provided. I'd like to reinforce kind of the key message that the reason we're holding these sessions is to make sure employers and rate codes understand that this transitioning is happening and what it might look like in 2019. So let's look at an example or some examples of how rate codes were transitioned. This slide shows the two examples of how rate codes were transitioned. The reason for the transition is to give industry and employers, like I said, time to adjust through 2018 to what you could be paying under the enhanced model for 2019 and going forward. To be considered for transition, the premium rate under the enhanced model was higher than the 2017 final premium rate. Once a rate code was identified as a transition rate code, their premium rate for 2018 is determined in one of two ways. Either determined under the old model or held to the 2017 level. So example one. In example one, the 2017 premium rate was $1. It was supposed to increase to $1.30 under the enhanced model. Transitioning means we would continue to use the old model, and in this case it provides a premium rate that is higher than 2017, but obviously lower than the 2018 enhanced model. So we use the old model to calculate a premium rate of $1.20. So we're transitioning, we're not charging you the whole $1.30 in this case. We're getting you partway there to $1.20, and then we would fund, through the injury fund, we'd fund that 10-cent difference. In example two, the final premium rate's $1. The increase was supposed to be to $1.05 under the enhanced model. Transitioning in this case means holding the premium rate to the 2017 level, so the industry premium rate was kept at $1, and the 5 cents would be covered through the injury fund. So those are just examples of how we determined if your premium rate was going up under the new model, the enhanced model. This is the process we use to determine ultimately what you would pay, to get you kind of part way so that you weren't hit with the whole amount of the transition from the current model to the enhanced model. This slide shows the difference. Oh, no. So with this slide, industry impacts provided in this presentation are comparing the 2018 premium rates from the old model to the enhanced model. The intent of providing this information is to educate on the model changes and provide potential impacts to employers. So 2019 premium rates will be developed using the enhanced model and will include updated experience. So for 2019, we'll be looking at the experience from 2013 to 2017. And the 2019 premium rates will be announced or presented in October of 2018. So this slide shows the difference between the 2018 premium rate using the old model and the enhanced model. Now, I'm not going to go through each one in detail, but I'm going to just give you kind of a high-level overview of kind of the ups and downs going from the current model to the enhanced model. When we look at credibility, under the current model, G22 was 94% credible. So what we would do is to get it to 100%, we would use the board level. Well, in this case, the industry premium experience, the industry cost experience, was better than the provincial average, which caused your experience to look like it was maybe a little bit worse than it was. By us using only your experience to get you to 100% credible, what it does is it actually reduces this component by 3 cents. So we're not blending your experience with the board experience anymore. By removing that, it actually, your experience looked better. And once we got to use enough claims cost experience to get to you to 100%, it caused this component of your premium rate to go down by 3 cents. Under the change of indicators, two things are happening here. One, to create a smooth effect from one year to the next. Our time loss claims typically in most rate codes were pretty volatile. As I said, many rate codes in Saskatchewan had low credibility. So in order to prevent bouncing around of premium rates, we would always blend the previous year's premium rate with the current year's. By removing that blending process, it shows the true experience, and in this case, it actually reduces this component of your premium rate by 15 cents. The other thing that's going on is the adoption of workforce. So again, with this, we're not using time loss claims to predict costs. We're using the evolution of workforce. And our data suggests for the past 2 years, healthcare as a whole has shown a slight decrease in the workforce. As a result, we're predicting lower costs. So the combination of those two things, not blending and a slight decrease in workforce, a prediction of a slight decrease in workforce, would have meant that you'd have seen a 15-cent reduction in this component of the premium rate in 2018. Under claims cost pooling, the average pension costs, so the way we did it under the current model was we pooled pension costs over $90,000. The average pension costs were typically 4% lower than the average G sector pension costs. This would have caused your rate to actually increase. The costs, and now we use 3 times max. We hit the maximum, then we pool everything over and above that. The costs in excess of 3 times max are 78% lower than the board average. Therefore, pooling costly claims are going to increase your premium rate a bit by 3 cents. So what that means at the end of the day is the amount that you're putting into the pooling is less than what the calculations are that are coming out. Because what we're pooling is a bit less than the provincial average or what's typically being pooled by rate codes. So when we, through collective liability, when we look at all those costs and reallocate them back to the individual rate codes, it causes a slight increase in this portion of your premium rate. Fatalities resulted in a slight decrease. I won't go into detail on that. The big one here is the long-term claims. This component increases reactivity and accountability by putting emphasis on the recent recent cost experience. So when we think about G22, most of your costs are happening in the most recent 7 years, as with all rate codes. Roughly 75% of costs for all rate codes happen in the first 7 years. But you guys have, G22 has a higher proportion in the first 7 years than most rate codes, which means the remaining 43 years, your tail of claims costs is smaller than most. So the amount, again, that you're putting into the pooling is less than what's being allocated back out, which is causing this 23-cent increase. So it's a collective liability. At this point, it's causing your guys' premium rates, or this component of your premium rate in 2018, to jump up by 23 cents. And the final component was administration costs. And by going from 90% variable to 70% variable, it meant that your your share of administration costs for variable costs, claims-related costs, went from 34.4 cents to 32.2 cents. And then going from 10% fixed to 30% fixed, you went from 3.3 cents to 9.9 cents, which was a net decrease of a cent related to administration costs. So when you put all that in the mix, there was a difference of 6 cents between the old model and the enhanced model. So when you take all the pluses and minuses, there's a 6 cent difference there for various reasons. So this slide is an illustration of how your premium rate was transitioned. So you can see from the 2017 premium rate, G22 was at $1.60. The old model produced a rate of $1.56. And then the enhanced model produced a rate of $1.62. That 6 cent difference is what we just went through, those line-by-line items on the various components of your premium rate. That's what made up that 6 cent difference and the reasons why. Your final rate for 2018 was $1.60. So the WCB through the injury fund funded the 2 cent difference. So what does this all mean going forward? All things being equal, your 2019 premium rate would increase to $1.62 in 2019. In order for that to happen, though, the claims costs and payroll for all industries would need to remain the same, which we know is not likely to happen because of updated experience, not only in your rate code, but other rate codes. So the 2019 premium rate is dependent on more than just your industry's experience and payroll. If the board's overall experience worsens while industry experience improves, the industry could see an increase because of the pooling applied to costly claims and long-term claims. In addition, the industry's share of the risk will be dependent on the ratio of their own costs to the overall costs. The updated experience will essentially determine the degree of change you'll see for your 2019 premium rates. So it's important to keep in mind that the updated experience will adjust how the rate model components respond, which will ultimately determine the 2019 premium rates. So if you have improved experience and industry overall has improved experience, that 2 cents is potentially reduced, eliminated maybe. Maybe your rate even goes down, who knows. But if your industry experience worsens and or the whole provincial experience worsens, you could see increases beyond that 2 cents. So today's presentation, in terms of what's next, today's presentation is recorded and will be made available on our YouTube site. As you review the information today, you may have more questions. So when you leave, it might take a while to soak some of this in, think about it, and you may have questions even after you leave. You can feel free to contact us. You can submit your question to AskWCB at wcbsas.com. We'll do our best to get back to you within a week. You can call us. If you're not sure even how to ask the question, or you've got a few questions, you can always call us and we'll do our best to try and answer any questions you've got. For those attending online, you can submit your questions in the same way at askwcb at wcbsas.com. And again, your 2019 preliminary premium rates will be made available in October. Just as a reminder, you can influence the premium rates you pay. And healthcare is one of them, but many industries have seen reduced premium rates over the last several years. Many employers have seen significantly reduced premium rates over the years. based on their intentional efforts to identify and control hazards in the workplace. So our ultimate goal is 0 injuries, 0 fatalities, and 0 suffering. Injury prevention is the best way to minimize costs and human suffering. Having appropriate safety programs in your workplace can be an effective tool to injury prevention. An effective return to work programming can help minimize costs and influence premium rates if done in the right way. There are resources available through your Industry Safety Association. Yes, see Sandra's here from SASWA. As well, the WCB account manager is available, and I see that he's here today. John's here today. We have the WorkSafe website that has different resources and training available. WCB offers some classroom training, or WorkSafe offers some classroom training. So there's various resources available to help guide you through decisions around preventing injuries and or effectively and appropriately managing injuries once they've occurred. So thank you to everyone for your attention to this, what we consider important information. This brings kind of the formal part of the presentation to a close. We'll now open the session for your questions. If we end up getting a lot of questions, we'll try and alternate from online to those here. And or if we get lots of questions, we'll try and alternate between people. But at the end of the day, oh yeah, and use the microphones. Just a reminder to use the microphones again, just so that everybody can online can hear the question that you're asking. So on behalf of WCB, I want to thank you for your attendance, and I'll open up to any questions you might have. Anything online? I've never known people in healthcare to be shy, but if you are shy, I can answer a question after if you'd like.
Hi, Phil. Thanks for the explanation.
Yep.
Okay, so G22, I mean, that's healthcare. We've been working really, really hard. Mm-hmm. And I think that we've seen about a 12-year or more trending downwards. And yet with the enhanced model, we're going to see a fairly substantial, well, I guess with the good work we're doing, the substantial increase. Mind you, we still have more to do. It just becomes a little difficult to understand the increase. And I mean, I appreciate you going through those 6 components. It is a new model. So first of all, it's difficult to understand. And secondly, with the new model, is there any plans for reviewing it in the future? Because I mean, with a 12-year history of going down, what's going to happen later?
Right. So good questions. First, yes, we will plan to review the model. It is new, so we're going to have to analyze and make sure at the end of the day it's meeting the intent. As we've learned from the old model to the enhanced model, things change, and we need to look at the model and make sure it's still meeting the needs. When we set out developing the model, and I shouldn't say we, when Eckler did the assessment, and at the end of the day we took the recommendations, we were focused on the principles and the components that made as fair as possible a model, a model that would be as fair to all employers in the system as possible. There are, to your point, perceived winners and losers through that. But the model itself and the choices that we made, we didn't know the impacts and what it would be to any particular industry when we decided at the end of the day that these are the recommendations that are important to create a fair system. It was only after the fact that at the end of the day we truly understood that how it would kind of shake out. And like I said, for most industries, they were seeing decreases in their premium rates based on the enhanced model. For the 14 that are going up, as you've pointed out, it can seem unfair because you haven't done anything different. And in most cases, most industries have improved over the last decade. But this is a redistribution of not more money, it's the same amount of money we need, but redistributing it in a different way. So the way we look at it, to your point, is different. And there's, to me, there's really two key components. Is it really holds, it strengthens individual accountability to rate codes for the most recent experience. But secondarily, it strengthens collective liability, because our previous system, in some cases, collective liability was stuck right at the rate code. There was no, if you had, and I'll give you an old example, where an industry had a busload of workers get hit by a train. That's a 1 in a million, I wouldn't say it like that, but that's a very rare event. Our old model would assume that event's going to happen every few years. And we would burden an industry and those employers over and over and over, assuming we're going to see that event happen. The way the new model works is those really rare events are going to get pooled. And right now, at the beginning of this model, you guys are being kind of hit by that, the cost pooling and the long-term claims piece. I know that's not comforting, but that's the key here, is that we didn't set out and look at how this impacted people at the beginning. We based it on what we thought were very sound principles and components that tried to create the most fair system that we could create.
Thank you. I just want to reiterate then, what you're saying is, presently right now, G22 is being hit with the sins of the past. And going forward, we'll be looking at the long term, and that will be paid in that year for that injury.
I wouldn't probably characterize it like that. What is actually happening is we're changing the way we pool costly claims and long-term claims. And the amount that G22 is pooling up at the board level is less than the way we're allocating it back. Because in an extreme example, it's kind of like, you know, one industry is putting in $1 million, pooling $1 million, and let's assume that's G22, and another industry is pooling $10 million, right? Now you got $12 million you got to reallocate out, and it is based on the proportion, so you're not going to take, you know, if there were only 2 rate codes, you're not going to take 50% of that 12 million, but you'll take a portion, and it'll end up being more than the $1 million that you put in. That's what's happening here in your particular rate code. It's your long-term costs and your cost pooling, what you put in terms of that pooling up at the provincial level, is less than what's being allocated back out. No, it's just the ratio of your claims costs in the first 7 years versus your claims costs in the last 43 years of claims experience. Your ratio of percentage of claims costs in the first 7 years are higher than most, which means your ratio of claims costs in the final 43 years are smaller than most industries. It's just the way that ratio of proportion of 7 years versus 43 years shakes out for your rate code versus what's typically happening. Jen, did I get that right? More or less.
Bill, could you speak a little bit more on the allocation of the admin cost, that 10 to 30% piece? Mm-hmm. Just in terms of so 30% of that is fixed, 70% management of claims. Can you speak a little bit to some of the potential additional efficiencies that might come in that pooling of dollars? Or is it based on current practice, just more of the same? Or is there any deep dive look into the efficiencies in that administrative piece at all?
So 2 pieces. It's the same amount being reallocated 70-30 versus 90-10. Because when we looked at our administration, all of our administration costs, about 30% were related to IT, human resources, registering employers, assessing their payroll. So those are kind of the fixed costs that we have, regardless of whether or not there's claims. In theory, if we had no claims, those would be the fixed costs for all employers. Because they'd still need to register, we'd still need to assess their payroll. So we look at all the salaries related to that, and that's about 30%. So our fixed costs now, instead of 10%, we're saying it's 30% of what an industry should be paying out of the admin portion. The 70% is related to the salaries who manage claims.
So for healthcare being such a large employer, we have frequency, not necessarily severity. Like, we're not going to see as many fatalities perhaps as another industry. So if we have increased frequency in claims, the likelihood of us paying that 70% of that administrative cost
If your
is
claims
higher.
significantly drop, you're going to be paying a less portion of that variable.
Right.
On the fixed side, it's kind of lights on. Every employer in healthcare
Yeah.
registers, they pay premiums.
Yeah. It's those unfixed.
Yeah, it's the variable ones.
Okay.
Yeah.
Hi, Phil.
Hi.
I just struggle a little bit with the complexity piece here. So when I
Yeah.
think about explaining this to stakeholders, explaining this to our board, I feel challenged in doing that in an educated way to help increase understanding. Have you put some thought to helping employers explain this?
Part of where we're at is that journey of the various presentations we've done. We've done some deep dive presentations that explain the model a little bit in more detail to kind of allow you to understand. If you understand the components, you understand a little bit better how they go together and create the premium rate. Were you part of some of the other previous presentations?
No, I wasn't personally. No.
So that might be where we start, is if we can go back, this presentation might make a bit more sense if you were to see kind of the breakdown of the components in a bit more detail. And I will say we got a lot of feedback on the previous presentations that we made a very complex concept seem pretty understandable. So I think if we were to somehow arrange for one of those presentations for you, your board, or a group of employers in your industry, I think it might make a bit more sense. That might be where we start.
Okay.
Yes. Yep. That's available on the website right now. The YouTube. There are YouTube. There's a white paper on it, as well as YouTube presentations that we've done in the past. If that's not convenient, we could.
No, I guess I'm speaking from my experience and conversations with others have not led me to believe that looking at that material still kind of simplifies it in a way that makes a lot of sense to be able to explain. And maybe it's our experience in terms of, as Christina's comment was around, it's an enhanced model, but our premiums are going up. That we really need to understand.
Right.
Yeah.
And if it's specific to your industry beyond what we've kind of provided here, again, there are YouTube presentations where we went into a bit more detail on the 2018 premium rate. But if that's not meeting your guys' needs, just contact me and we'll see if we can provide more information. I mean, it is inherently actuarial sciences. It's complex. For me, I'm not a mathematician, I'm not a statistician, and I'm not an actuary. And it's taken me from the inside out months to understand at a very basic level this information. I don't want to make excuses, but it's not easy to understand inherently. Any other questions? Anything online? No? Okay.
I just want one more little clarity. So when you talk about the allocation of the admin costs, am I correct then in that it used to be a 90-10, 90 being flexible, 10 being fixed, and now it is 70 flexible and 30 fixed. So we used to be able, as an industry, to influence 90%. We now can only influence 70. Is that correct?
Right.
Okay. So I guess I would ask then, we make an assumption that 30% or the previous 10% is the right level of administration. So is anything being looked at for efficiencies? I guess we're just challenged all the time, right? To look, so that would be a question I would challenge up WCB as a partner with us to look at as well.
Yes, and we would agree. We've been going through the last few years of continuous improvement, looking at how to better serve the customer. For us, it's greater value in terms of what you get for your dollars. We're not inherently looking for cuts per se, but if they come along, that'll either get returned as an enhanced service or just the fact that we maybe don't need those dollars. So we are constantly looking at improving our processes and the way we serve our customers for the dollars that you provide. Yep.
I understand that there aren't WCV surpluses being given back this year. Can that factor into any of this? Can that help mitigate some of the expenses?
The premium rate is kind of the premium rate. We run the costs through. This transition year would be very unique for us. We don't typically subsidize premium rates or cross-subsidization of premium rates in any way. And the reason being is kind of the model is the model. The reason we've paid out surpluses is typically because our investments returns have been higher than anticipated. We anticipate, I don't know, 4 or 5% investment return. Because they've been over that, we can't count on investment returns to carry us forward. I'll say it's my belief that there are other organizations that have done that, tried to count on investment returns to subsidize premium rates. And when those investment returns disappear, it doesn't usually go very well. So it's a bit of a dangerous, I think organizations have to see the cost of their insurance. Subsidizing it through investment returns that may or may not be there, I'm not sure is the best way to approach reducing your premium rates. My argument, anyway.
Hi, Phil. Thanks
Hi,
for
Lori.
this.
Yep.
I have two questions. One of them is about the money that's come out of the injury fund to supplement for this year, 2018. I'm wondering, do we know how much that is, and is there a way to recoup that money down the road? It concerns me that that's where that's coming from. And my other question is, because healthcare has done really well in the past to bring down the injury rates and the claims, I'm really concerned as both a on-the-floor worker, but also as somebody that represents workers, is that our employers are going to see this increase, which I agree is also going to be a substantial increase, and that's going to, those funds are going to come from the good work that has been done in the past. And so are you anticipating to see an increase in the rate of injuries in the next little while going forward? Because we all know what it's like in healthcare. The dollars only go so far, and I am concerned that they're going to claw back some of the good work that's been done. And so I don't know if you have an answer to that question or if you've even considered that could be a possibility, but I see it as a real concern.
Well, at a very basic level, obviously, we want the premium rates to motivate the right behavior, focusing on appropriate and effective injury prevention and return to work programs. I wouldn't say that we had anticipated the premium rate change as impacting the way employers think about managing health and safety, and or as they continue their journey of trying to create a culture that values health and safety. If we notice differences, as you know, we have a provincial strategy in partnership with SASWA. We have quite a significant focus on healthcare due to the number of injuries and the injury rate. So, you know, we constantly pay close attention. If we see anything that signals injuries, injury rates, the culture of health and safety going in a negative direction, we would certainly be prepared to meet with industry and talk about what we need to do. But based on the rate model change itself, we weren't anticipating a change by the industry in the way they're approaching injury prevention and or the good work that the industry has done to try and create that culture that values health and safety. I would agree with you, the industry's come a long ways, and we're not anticipating this to have a negative impact on that.
Phil, can I just add to that?
Yep.
So, as Phil explained, when we looked at the rate model itself, and I forgot what the principle's called, but how we estimate what the future costs are going to be. And in the past, we relied heavily on injury frequency as a determinant of how costs in the future would be adjusted. So effectively what we would do is we would look at the last 5 years of claim cost experience, calculate an average, and that would be our base. And then we'd look at the frequency of injury, and depending on whether injury rates were going up or down, we would adjust those costs for the future based on what we thought would happen with respect to injury rates. What we discovered through reviewing the rate model, as Phil explained, is there's no longer a correlation between injury frequency and claims costs. So keeping our eye on injury rates as it relates to the rate model is the wrong indicator, because injury frequency no longer influences the rate model. Claims costs influence the rate model. What we're doing is we're still calculating that 5-year average, but now we're looking at the change in the workforce. So if the workforce is forecast or has increased by 3%, let's say, we're going to assume that that average cost that we calculated based on 5 years' experience is also going to increase by 3%. So that's one of the fundamental differences in terms of using the change in workforce to help us forecast claims costs as opposed to injury frequency. Because costs are increasing even though claims are coming down. And so I guess all I'm saying is we shouldn't be counting on injury rates by themselves as an indicator as to whether your premium rate is going to go up or down, because it's fundamentally based on the costs of those claims.
Anything online? No. Any other questions? I mean, just to add to Peter's point while you're deciding whether or not you have another question. I mean, obviously, if you have 0 injuries, there's no costs. So in some respects, but the challenge is predicting when there's an injury, will that injury cost $1,000 or $1 million? And what we're finding is the tendency is the low cost injuries are the ones that are being stripped out of the system, being eliminated, and some of the higher cost injuries are the ones that are staying, which is why we're not seeing a correlating reduction in costs when we see the reduction in injuries. So we still have work to do in terms of trying to figure out how to reduce some of those more severe claims, whether that's more effective claims management and helping workers return to work safely, and or if it speaks to more severe injuries that are just left in the system, and how do we identify and deal with those more severe injuries. And it's probably a combination of both issues. Any other questions? Perfect.
I guess you just kind of touched in, and I know this is rate setting, but we have a dedicated staff throughout the entire province working on return to work and accommodations and faster bringing down our long-term claims. And we met yesterday collectively, and we would really like to have our own adjudicators and our own case managers collectively now that we're one health organization across the entire province. And I think we can bring down some of these longer term claims if we do have the dedication towards that from the board, because they need to understand how our business works and how our return to work is set up, and et cetera. And I don't think this is necessarily the right platform, but that is something that we would like to see provincially with my colleagues at a provincial level, is the same case managers, the same adjudicators here in Regina for the entire province, because we do the same work, and we're working with our members and our membership and our unions very hard to bring down these costs and to bring early return to work and accommodation planning, and we sometimes feel it's delayed at the board level and particularly the adjudication level.
Yeah, so this speaks to Christine and Sandra's question about, you know, ongoing improvements. We are focused, right? Whether that's the solution or something else in terms of effectively communicating. I mean, the key to getting somebody back to work safely and quickly and appropriately is effective communication between all the areas involved. The healthcare practitioner, any of our staff, the employer, the worker. We need effective communication processes between all those players and all those parties to make the right decision at the right time to keep the ball moving. So whether it's what you're talking about or something else, we would tend to agree with you that there is a need to figure out, and we are actively working on, how do we facilitate to get the right information to the right people at the right time to keep things moving safely and quickly forward. We agree. And again, we agree with the principle of what you're saying. Any other questions? If not, I would really like to thank you for coming today, for those online that participated, obviously the attentiveness and all the great questions that you guys asked. Really appreciate you taking the time and participating in this. So thank you very much, and wherever you're traveling, safe travels home. Thank you.